Why is Parkinson's disease polypharmacy so complex? Imagine juggling many balls at once, each representing a different medication. Managing medications for Parkinson's disease is just like that, but even more complicated because each patient is unique. Parkinson's disease affects not only movement but also mental health, sleep, and other body functions. Many patients have other health issues at the same time, called comorbidities, like depression, anxiety, heart problems, or cognitive changes. These additional conditions often requiring their own medications, which adds to the total number of drugs a person must take daily. Because of this, Parkinson's patients often end up on a mix of medicines from different classes. There are drugs to help with tremors and stiffness, called dopaminergic therapies, but also medications for pain, depression, or blood pressure. Each medication has its own effects and possible side effects. When combined, they can interact in ways that make managing the treatment more challenging. For example, some drugs might increase the risk of dizziness or confusion, especially in older adults. The more medications a person takes, the higher the chance of adverse effects. This can include cognitive decline, increased falls, or hospital visits. Parkinson's disease itself can make the brain more vulnerable to these side effects, especially since some medications can cause neuropsychiatric symptoms like hallucinations or confusion. This makes it essential for healthcare providers to carefully balance the benefits and risks of each medication. Managing so many drugs also makes it harder for patients to stick with their treatment plans. Forgetting doses, confusion about timing, or feeling overwhelmed can lead to missed doses or incorrect use. Factors like mood disorders, cognitive issues, or lack of social support can make adherence even more difficult. As Parkinson's progresses, symptoms worsen, and new complications often develop, requiring adjustments or additions to the medication regimen. This ongoing process demands close monitoring and frequent review by healthcare professionals. Every person with Parkinson's is different, so their medication plan must be tailored specifically to their needs. Doctors, pharmacists, and caregivers work together to review and adjust medications regularly. They aim to keep symptoms under control while minimizing side effects and interactions. Education about medications and simplifying regimens where possible can help improve adherence and quality of life. In essence, the complexity of polypharmacy in Parkinson's disease comes from the interplay of multiple health conditions, diverse medications, increased vulnerability to side effects, and the disease's progressive nature. It highlights the importance of personalized, careful management to ensure each patient receives the safest and most effective treatment possible. Always consult healthcare professionals for individual advice, as each case is unique and requires careful consideration.